What causes swayback and how do you prevent it?
Well, there's no answer to either of those questions, so we're done. No,
That's the end of the episode.
so swayback would be the colloquial term, and the term that the veterinarian would use is lordosis.
Mm-hmm.
And lordosis means an inward curve of the spine or an arch, versus kyphosis is an outward curve or a hunch, and then scoliosis is a sideways or lateral curve.
Yes.
So they all have names. It's hard to tell what she's thinking of. There's early onset lordosis, like in a young horse, and then there's the old age associated or late term,
Which most people feel is common.
yeah. And as
see.
as the horse ages, the soft tissues that hold the spine rigid begins to sink. Those tissues become lax or loose, and the muscles in the belly and the back sort of become less strong, and the whole thing sort of sags over time.
Okay, so the muscles in the abdomen is not strong enough to also keep the back up. Plus
Yeah.
the back muscles are...
Ligaments in the tendons, they're sort of loosening and softening and they're not
So
as
that's gonna start
structurally
to get to
sound.
the-
Yeah. So now, but it's different in the young horse. There's a theory that the young horse, there's a deformity in the vertebrae themselves. Because if you're 18 months or 2 years old and you have not a gentle sag like an older horse, but a pretty extreme, that looks different, and you would suspect the bony shapes to be different, and then radiographically it's been shown they are.
So there's something more severe going on.
Yes, but interestingly enough, horses are one of the only species that can have a significant lordosis and not be affected. Like, they can still have a normal, long, healthy, productive life.
But could you ride them?
Yes.
Interesting.
Yeah. It does not seem to affect their performance, their way of going. You can still be a broodmare. I mean,
Huh.
Yeah.
Because, I mean, we've all seen that horse who looks a little dipped in the back, creates a nice little seat for you to sit in. But I always thought, like, there might be some discomfort that goes along with that. But
it doesn't appear to be just talking about the back issue. Now, when you put a saddle on, then you could create an issue, because if you've got a back that dips, now you've got the potential to create bridging, where the front of the saddle and the back of the saddle touch, but the middle doesn't.
Okay, so now you're, like, hitting weird pressure points.
Yeah, so now you have to be really, really careful that your saddle fits if you're going to continue to ride a horse that ages into it, or a horse that just has it from the get-go.
Well, there are a lot of saddle pads now that are designed to kind of help with some of that bridging for horses who do have some sway back to kind of help that out a little bit.
Yeah, and I would probably engage the services of a saddle fitter
Absolutely,
to help
absolutely.
to make sure. A couple more things I wanted to say was that the reason this is not studied a lot, and so the causes and prevention and correcting, is because only about 1% of the general horse population has this, and it's just not enough for the money to be there to research it. About 7%, though, of American saddlebreds have this. And I'm sure you were thinking of
yes.
that. Great. I mean, it can happen to any horse, but saddlebreds, they are now confidently saying there is a heritable or genetic component to it. The specific gene has not been identified, but they're really close. They do know that the gene is recessive, not dominant, which means you have to have 2 copies of it to show it. So the sire and the dam must both have a copy.
Got it,
If you remember your Mendelian
I remember
genetics.
my little Punnett square. I need to come in handy one day.
So it's seen more often in saddlebreds, and when it comes to causes, for saddlebreds at least, there is a genetic component preventing it, other than not breeding 2 horses that have it. Yeah, that would not. That's the only way you can prevent it. And then once it begins, I mean, there's not really anything you can do about it.
I was going to say there's not like any sort of like exercises you could do to help support the abs and make sure the horse is like engaging. But
maybe for the old age onset version of it, you could encourage them to have that lift in the back and the roundness, and do exercise that support the abdominal muscles. But I think you're just prolonging it, or extending their normal lifespan or slowing the progression down.
It's not going to cure it. You're
Yeah,
just
you're just slowing
Got it.
things down, slowing the inevitable down.